Hi, I'm Dr. Kawita Bapat. Learn simply. Hashtag vaginal surgeries. Ovarian dermoid tumor is the topic today. And for the undergraduates, graduates, and practicing OBGYN. The ovarian dermoid tumor basically, normally the origin of all the ovarian tumors are from three things. Number one is from the surface epithelial stroma. Number two is from the germ cell. And third is from the sex cord stroma. The surface epithelial stroma, there are serous, mucinous, and endometrioid clear cells. And from the germ cells, there is a dysgerminoma, yolk cell tumor, embryonal carcinoma, choriocarcinoma, and sex cord, there are different tumors. Now, normally, when the germ cell meets with the sperm, there is a formation of multiple layers and the large number of layers are formed. Few days later, these large number of cells are basically form three layers. And these three layers are, they are around the surface. These are ectoderm, endoderm, and a mesoderm. These three layers are responsible for formation of all the human tissues. From the ectoderm, we form the skin, the epidermis, the hair, and a nervous system. From the mesoderm, there is a bone, muscle, cartilage, and connective tissue. And from the endoderm, the formation of stomach, intestine, colon, and liver, pancreas, and bladder. These are the multicystic things. So the ovarian dermoid cyst is formed by the single germ cell. And this is the most common ovarian tumor in a woman in second and third decade of life. This is a big multicystic lesion, and it is having a bone, hair, skin. And because of it is a germ cell origin, it has got all the human tissues. And along with that, it is mixed with a material which is sticky, sebaceous, and a foul-smelling material. So this is ovarian dermoid cyst. And this ovarian dermoid cyst are basically, normally they are benign, but there are chances of malignant changes in 0 to 2%, 2 to 2% of the mature cystic teratoma. And risk factors for the malignant changes are important, and they are: if the age of the patient is more than 45, if the tumor size is more than 10 centimeter, if there is a rapid growth, and Doppler showing the low resistance intratumor flow. So they can turn into malignancy. The presentation of the most of the cases are asymptomatic. Sometimes there is a mass we can feel. There are the pressure symptoms. Patient can come with an acute abdomen like a torsion, rupture, and these are the presentations they have. But the definitive diagnosis is made by histopathology, and another thing is by the ultrasonography. There are the characteristics ultrasound features with it. There are three characteristics. Number one is the dermoid plug. Number two is the dermoid mesh. And number third is a floating fat globules. The dermoid plug is basically a hyperechoogenic nodule inside the cyst. And because of the hair, tooth, and sebaceous material, and no blood flow inside the nodule, it looks like this, and it is associated with a distal hypoechoic area known as acoustic shadows. These are, we can see into the ultrasonography. This is the hypoechoic dermoid plaque with the acoustic shadows. These acoustic shadows, sometimes they cover into the larger size of the dermoid plug, and they just cover the whole area of the dermoid plug. Only the superficial or the top surface is seen over there. So it's just like a tip of the iceberg, and we can also see this tip of the iceberg in a sonography. So this is also a sign and a confirmed diagnosis of ovarian dermoid cyst. So the tip of the iceberg is there. Number two is the dermoid mesh. Dermoid mesh is basically another feature. There is a hypoechoic area with punctate linear cystic echoes of the hairs, like a hair strands, seen into the cyst, and they are also the characteristics of the dermoid mash. Another point is the floating flat globules. These are the floating flat globules can be seen into the cyst, and we can diagnose is on the ultrasound also. So very important, all three signs: floating fat globules, dermoid mash, and dermoid cyst. Now, how to manage the dermoid cyst? The management is ovarian cystectomy suggested. It's a definitive diagnosis is also very important. Preserve the ovarian tissue if the patient is young, and we can avoid the complications like torsion, rupture, and a malignant changes. Sometimes we need to do the salpingo-oophorectomy is acceptable option if the family is completed. So ovarian tumor, ovarian dermoid cyst is an important issue, and it is like this. Thank you.